It's my great pleasure to be able to introduce your keynote speaker, who has had a remarkable journey really transforming the health of communities. There is nothing more central to the work of Dr. Robert Ross than what he has done in impact in every corner of this country. He served as a pediatrician, a policymaker, and a philanthropic leader. He currently serves as the president and CEO of the California Endowment, a foundation working to address public health on the front line in communities across our state and at the policy level. It's not a small feat in a state with 39 million. He's doing this building on an extraordinary career. He served as Commissioner of Public Health for the City of Philadelphia, Director of Health and Human Service Agency for the County of San Diego, Medical Director for the Link School-Based Clinic Program in Camden, New Jersey. Under his leadership at California Endowment, they've launched a 10-year, billion-dollar effort to build healthy communities in 14 California communities. He's been named to the nonprofit Times list of 50 most influential nonprofit leaders in America. But more than anything, he embodies this notion that health is something everyone deserves. So please join me in welcoming Dr. Ross.
So my gown came without a cap, so I got my own. Best looking cap up here, isn't it? Oh boy, truly flattered, humbled, honored to have this moment of time with you as graduates and you as families and friends, and of course this phenomenally spectacular faculty at the Fielding School. Honored to work with and be introduced by your visionary dean, Jody Hyman. A round of applause for Jody and her spirit, her passion, her energy. And of course, our great friend, mentor, colleague, hero, living legend in public health, and that's Jonathan Fielding. Round of applause for Jonathan. Where are you, Jonathan? So congratulations to the graduates on this day. Before I get into sort of the body of anything that might be useful in terms of commencement speeches, I don't remember any of mine when I graduated from either med school or undergraduate school. But if you can remember part of what I said for a day, I think that's a success. But there are two items I wanted to get out of, two business items I wanted to get out of the way, and this is specifically for the graduates. Number one is in the form of I guess my heart goes out to you, and it has to do with student debt, right? So I don't know what to say to you except maybe I feel your pain or imagine your pain. A public policy fix would be a heck of a lot better than me standing up here slobbering about student debt, but it is a serious issue in this nation, and it needs a policy fix. And just think of all the brilliant, energetic, creative young minds in this nation that this country is not tapping into and taking advantage of because of that issue. So you can put that on your list as well, and we won't give up on it either to address that from a policy standpoint. And then the second item of business is an apology from my generation to yours, graduates, about some of these messes we're leaving you to clean up. and particularly the mess of structural inequality in this nation. So, but I have a prescription for the next 8 minutes about how precisely you're going to fix it. So I want to start, I know at commencement speeches, there's the obligatory need to think visionary and bold and futuristic, but I actually want to go backwards for a minute with you first. And what triggered this for me, it was about 2 weeks ago, I was flattered to be honored at a community organization in San Diego called the Union of Pan-Asian Communities, or UPAC. And I was one of 4 honorees that evening, and they were honoring me and our foundation for our work on the Affordable Care Act and expanding health coverage for immigrant populations, and we were very honored to do that. But one of the other honorees was a 90-year-old gentleman, Japanese-American gentleman, who was a member of the 442nd Combat Battalion in World War II. And this particular combat battalion, the 442nd, was a Japanese-American outfit. It was a Japanese-American division. And they fought in the European theater of operations in World War II. And I came to learn that they were one of the most highly decorated combat units in military history, in United States military history. And this particular gentleman had his family, as many as other, literally thousands of Japanese families, after Pearl Harbor, the attack on Pearl Harbor and the entry of the United States into World War II, Japanese Americans were interred in camps around the country, particularly here in California, and his family was among those families interned. And so it just had me stopping and thinking for a minute, putting myself in his position. If my family or your family had been moved from your home, from your community, into a camp, people stripped of businesses and education and other kinds of just their civic and cultural fabric just ripped from them, and moved to a camp, and then in the very next instant, signing up for the military to go across an ocean thousands of miles away to risk my life and spill my blood for the country that just humiliated my family. And I just stood there in awe of this gentleman. I was wondering what I was doing being on the same stage with this man, getting this honor. And this particular Japanese-American soldier, with many, many others, made me cry too, I hear you. This particular Japanese-American soldier in that unit, with heavy, heavy losses, performing the greatest patriotic act for a country that robbed them of their dignity. And it had me thinking about grandmoms and granddads and great-grandmoms and great-granddads and great-great-grandmas and great-great-granddads, and what they do for us and what they have done for us, the sacrifices they have made, the courage they have displayed, so people like us can be in robes like this, in a hall like this, on a beautiful day like this, those of you graduating from among the best public health schools on the planet, Jody would say the best on the planet, and how people in our family and in our ancestry and in our lineage have sacrificed, spilt blood, sweat, tears. They did that then, so you could do this now. And it's the remarkable thing about this country of ours, and there's a lot of things our country needs to fix, but it's pretty remarkable how this place can work and live to its promise. This place, this thing of ours called America. So with that, I'm going to take a little risk. Families, one of the things that we do in public health is we do a lot of surveys. I'm going to survey this audience right now. I don't know how this is going to end up, but I'm going to try it. We're telling you guys to take risks, so I'm going to take a risk right here, right? So I'm going to ask 3 questions of this audience, and I want the entire audience, families, graduates, faculty, to participate and answer, okay? First question. If either any of your great-grandparents were raised in poverty, raise your hand. Great-grandparents. Okay, check the room. Okay, hands down. If any of your grandparents were raised in poverty, raise your hand. Okay. And if either of your parents were raised in poverty, raise your hand. Okay. I don't have exact numbers. I didn't count that quick. But it gets lower, right? With each passing generation, right? That's what I love about this country. That's what makes America the place it is. That's why this country works. Because every generation has the opportunity to do a little better by the generation, at least a little bit better by the generation that follows. And that's what's so spectacularly peculiar about this nation of ours. The combination of freedoms that we have and opportunity that we have so that my children should do better than I did. And I should do better than my parents, right? And we saw in this sort of very quick survey, there's a sense that okay, there's economic mobility, right? There's movement in the right direction. Opportunity does work. But right now, that trend we just saw is threatened in this nation. Structural inequality and poverty is not moving in the right direction in this nation, and you know that, right? And so, what does it have to do with receiving a degree and a master's in public health or a doctorate in public health? I want each of you to think about channeling that person in your lineage, in your history, that family member, be it mom or dad, or grandmom or granddad, or great-great-grandmom or great-great-granddad, who at a moment of poverty or desperation or strife or oppression took the risk and mustered the courage to change the course of generations of your family. Somebody did that for you. It may have been a generation ago, or 2 generations ago, or 3 generations ago, or 4 generations ago. The fact is, in America, most Americans are less than 4 generations away from poverty. Okay? And it may very well have been, for me, certainly as an African American, the legacy of slavery and Jim Crow and discrimination. If you're a Native American, the legacy and the history of genocide and massive displacement. If you're Asian or Asian Pacific Islander, your family may have faced discrimination after entering through Angel Island, or perhaps after the ravages of the Vietnam War or the Cambodian genocide. If you're of Irish descent, perhaps a few generations back, your lineage may have weathered the storm and the crisis known as the Great Irish Potato Famine. If you are Jewish, perhaps your family survived the specter of flagrant European or Russian anti-Semitism, and perhaps even the nightmare of the Holocaust. If you are of Armenian descent, then maybe your family weathered the painful saga of genocide. If you are Mexican American or Central American, then perhaps your family crossed borders and picked strawberries or lettuce in the blazing hot sun to give you the opportunity you have today. And so I just want you graduates, in a few minutes, you're going to stand up and walk across this stage, and you're going to get this piece of paper with a gold seal in the corner and your name on it. And I just want you for a moment, as you're crossing this stage, when that piece of paper hits your hand, to think about and honor who it was that did that for you and your family. Who it was that was responsible, had they not weathered the storm, weathered the oppression, dealt with the racism, dealt with the marginalization, dealt with the civil strife, dealt with whatever that crisis was, and mustered the courage so you could be here today, taking extraordinary advantage of the opportunity they gave you. So I just want you to give that a minute as you're walking across on this stage, and this is why. Because those family members, that lineage demonstrated courage and audacity and fight and risk-taking, and we're going to need every single one of those traits to make this nation a healthier place and to make this planet a healthier place to be. It will be time for you to pay it forward. And you've chosen a profession of public health that, in my view, lies at the very fundamental underpinnings of the principles of freedom and opportunity that make this country so special and make this country so great and so remarkable, but also on the cusp of crisis. Without fair and decent health, you know this, the conditions under which families can be healthy. Without that, we cannot take advantage of the principles of freedom and opportunity. Those principles of freedom and opportunity get wasted. They get lost. And we lose the strength and enormous capital of human passion and creativity and problem solving that our nation and our planet needs. So I want you to think about that person in your family who mustered up the courage and mustered up the fight, because you're going to need that. We're going to need that. We're going to need that from you in making this planet and this country a healthier place. And it's true that the public health evolved as a discipline stemming largely from communicable disease control and disease protective activities. But now public health is much bigger than that. With chronic disease, as mentioned by the dean, right now, public health stands for all that is the best of this country has to offer. Public health, as you heard from Dean Hyman, is inclusive. It is about diversity. It's about everyone being in the boat and being healthy and no one being excluded. Public health builds bridges. It does not stand for building walls. And so, just as an example, tonight, maybe tomorrow night with your families, you're going to go to a restaurant. You'll walk on that restaurant, and more than likely in that restaurant, there'll be a little card in the window in the door. That card will say A, B, or C, right? Preferably A, right? And that's an example of the inclusiveness of public health, because it doesn't matter who you are when you walk in that restaurant, you are protected by the same set of conditions and the same standards. When you walk in that restaurant, it doesn't matter whether you're black, white, red, yellow, tan, immigrant, citizen, poor, rich, ordering a Chateaubriand or ordering tofu. You are protected by the mission and the function of public health, and everyone is included in that protective function. Right? And public health, given where this nation is and this nation's election this year, which is extraordinary by any stretch of the imagination. And I don't want to talk about the people running. I want to talk about the issues that we're hearing. The issues that we're hearing that are central to this election and this nation's, I think the struggle for this nation's soul are about two things. One is inequality and opportunity. And the second is who's in and who's out. Who's included, and maybe who should be excluded from the American dream. In public health, that answer for us is fundamentally clear. That is not a debate for our profession. That is not a subject to question. Everyone in equal opportunity, everyone healthy, make this nation great. That's what we stand for. That's what we believe in. That's what we do. That's how we roll in public health. All right? So I want you to think about channeling that courage, that fight in your lineage to muster up your own decision, graduates, about what fight you're going to pick. It may be a new fight, like the Zika virus. It may be an older foe, like HIV/AIDS. It may be in moving fitness and wellness forward against the epidemic of childhood obesity. It may be in researching ways to get young drivers to stop texting and driving. It may be in working to eliminate the embarrassing scourge of homelessness in our society. It may be in empowering women in developing nations to assume leadership roles to advance wellness and opportunity in their own communities. It may be in assuring that Syrian and Central American refugees have access to the dignity of health and services in this country. It may be in assuring that marginalized LGBT and queer young people are systematically included rather than excluded from vital supports and counseling. It may be in assuring that prisoners and ex-felons are assured an opportunity to rebuild their lives through access to substance abuse treatment and mental health services. In the state of California, graduates, since the 1980s, this state has built 22 new prisons and 1 new University of California campus. We can't have that. We can't have that. The future of a great nation doesn't work when you're out building universities 20-1 with prisons. It may be in joining the battle against a new scourge in public health, which is the sexual trafficking of young women. It's become clear to us that the drug gangs and drug cartels have discovered that trafficking young women is not only lucrative, but safer than selling drugs because it's much harder to prosecute. And so we need an awakening around sexual trafficking, and we need this nation to understand through policy there is no such thing as a child prostitute. Public health can make that argument. It may be in researching the public health effects of child trauma and toxic stress in the school setting or in foster care. It may be in the battle to end incarceration of young people in this country. It may be in taking on the soda industry. And by everything we've seen in public health, we need to take on the soda industry, which is going to be a tougher foe than big tobacco. And public health needs to put an ass whooping on the soda industry. Okay? So, just in closing, you've learned a lot about the science and the research and the data behind public health. And public health, I'm proud to say, is a science-driven, evidence-driven discipline. But I want you all to recall, and this is why I ask you to think about your ancestors and the fight they brought to give you the opportunity they had today, because we're going to have to fight. The science does not walk into Congress, particularly this Congress, and turn into policy. You have almost an entire major political party that disavows and urinates on the science behind climate change. Right? So the science and the data are important, but we got to fight. We got to be activists with our public health. We have to be activists with our science. We have to be activists with our data. And do that in your own way. I'm not here to prescribe how you do that, but I want you to, right now, you guys have been trained by this phenomenal institution to be warriors for public health, and I would argue warriors for freedom and opportunity in this nation. We must fight. Quoting a great African-American activist, power concedes nothing without a demand. It never has, and it never will. And so I want you to continue to think about your work, not just through the science, but through the power and the dignity of advocacy and the fight. So back to Grandma and Grandpa, their wisdom, they're the ones who said, you know, when you have your health, you have everything. No need to publish an article about that. That is a powerfully true statement. And I just want to say on behalf of us at the California Endowment, and I'm certainly speaking for the faculty, I've never met most of you, maybe any of you. I'm not embarrassed to say, graduates, that I love you. I love you for the profession you have chosen. I love you for the craft you are becoming warriors at. I love you because you have chosen this profession to make a profound difference in this world. God bless you. Pick that fight, kick that butt.
Thank you so much, Bob, for those extraordinary words, for that inspiration, but even more so for all the fights you've already fought on behalf of public health around the country and that you're continuing to fight. We're all deeply indebted.